Diabetes is a metabolic disorder. There's type 1 diabetes, which comes on very suddenly, usually found in the about 15% of the population, usually diagnosed under the age of 20. Often symptoms of type 1 diabetes come on very quickly. You may see increased thirst, increased urination, weight loss without really trying to lose weight. Increased hunger is often seen also. And we also see lots of times blurred vision and fatigue in type 1 diabetes. Type 2 diabetes is a metabolic disorder often found in about 85% of the diabetic population. Most people with type 2 diabetes are diagnosed over the age of 45. It is a progressive disorder, often related to lifestyle changes that come along with age. The signs and symptoms of type 2 diabetes come along pretty slowly, very subtly. We often chalk those symptoms up to something else. And some of the things you see in type 2 diabetes, you often see increased fatigue, you see increased urination, increased thirst. Often we see some hunger come along with that. And we may see headaches, blurred vision, and we often can see weight loss without even trying to lose weight. If we look at risk factors, we really kind of look at type 1 versus type 2. With type 1 diabetes, the risk factors is often found genetically. It's an autoimmune disease, which means we're not really sure why type 1 diabetes occurs, but sometimes we see it occur through our genes, through our genetics. We see it occur in families. Also, if a person has had an injury to their pancreas or some type of disease to the pancreas that inhibits the pancreas's ability to make insulin, that person is diagnosed with type 1 diabetes if there's no insulin being produced. Type 2 diabetes, again, is a progressive disorder. The symptoms of type 2 come on very suddenly, and some of the risk factors of having type 2 diabetes, biggest risk factor is obesity. And also one of the second biggest risk factors is age. Most people, if you are over the age of 45, and also you have a strong family history of type 2 diabetes, and you add obesity to that, those are the two major risk factors of the development of type 2 diabetes. Other risk factors include gestational diabetes, which is diabetes during pregnancy. Women are more at risk for developing type 2 if they've had gestational diabetes. Also, our ethnic background, people that are of Hispanic descent, African American, Native American, Pacific Islanders, even people from Alaska. Those ethnic backgrounds are more at risk for developing type 2 diabetes. Also, if a person has developed pre-diabetes, they are more at risk for developing type 2 diabetes anywhere from 5 to 10 years down the line. And often people that have type 2 diabetes don't even know they have it, and they've actually had the disease anywhere from 4 to 10 years before it's actually ever diagnosed. Our main goal is to get people to be tested. If they have risk factors, then take a moment, go to your doctor's office, get yourself tested for type 2 diabetes.